I'd like to call to order this meeting of the Assembly Health Policy Committee. It is March 4th, 2020, and we are noticed from 10 a.m. to 11 a.m. Let's go ahead and start by identifying ourselves for the record. Ms. Davidson, would you start?
Yeah, sure. Austin Quinn Davidson.
Suzanne LaFrance.
Felix Rivera.
Forrest Dunbar.
Derek Kaiser, Anchorage Health Department, PI.
Bruce Chandler from Health Department.
Natasha Pineda, Health Department.
Start by Carissa, Secretary Clerk's Office. Jason?
Jason Bockenstead, Mayor's Office.
Ethan Berkowitz, Mayor.
And let's go ahead in the audience, starting with Mr.
Ron Oliva, Grubstake.
Lance Wilbur, Office of Management and Budget.
Deanne Fetco, Anchorage Health Department.
Kay Vogel, Municipal Attorney.
Quincy Arms, Municipal Attorney's Office. Nicole Lebo, Anchorage Health Department.
Jeff Estes, ConocoPhillips.
Michelle Mallory, ConocoPhillips.
Brent Robinson, KTUU.
Morgan Crago, Anchorage Daily News.
Eugene Carlhaven, Central Point, Government, Washington.
Great. Thank you all for being here. Welcome.
Madam Chair, I'm
And
also on the phone.
thank you, Mr. Constant. We have Mr. Constant on the phone. Is anyone else on the phone? Okay. Thank you all for being here. Hopefully everyone has a copy of the agenda by the door. We'll go ahead and get into our new business and turn it over to Ms. Pineda, Director of the Anchorage Health Department, for an update, a general update, and then if you want to just go ahead into the coronavirus update
Sure.
after that. Thank you.
Okay, I'll try to stick to no more than 10 minutes on just the department update, but since we haven't met for a month or so, there's a couple things we want to make sure you're aware of, and then we will get to the most interesting topic of the hour. Our department is continuing to work despite lots of disruption from our current situation related to the coronavirus on quality improvement teams and moving forward with evaluating public health accreditation. So that continues at our department. The Adverse Childhood Experiences request for proposals will be released soon. I shared a timeline with Assemblymember Rivera. We were able to work closely with the state, an epidemiologist and a researcher who is doing a longitudinal study on adverse childhood experiences, and he was able to give us really specific census tract data about areas in our community where we have high rates of child maltreatment and high incidences of adverse childhood experiences. So we focused the funding on entities that could work in those specific schools that were related to those census tracts. So that'll be coming out. It was a nice data-driven way to approach distributing those funds. So that'll be coming to you soon, I'm sure. Oh man, I just shrank my whole thing. I'm trying to be more modern. Let's see. Okay. PIO update will come when we talk about coronavirus pretty much exclusively for the last 6 weeks. It's all we've been working on at our health department. Main update on the cemeteries. We did have a meeting last week actually with Robin Ward and representatives from the Eagle River and Girdwood cemetery projects to discuss project coordination. So that continues to move forward. We did submit a request for information to the public for year-round emergency homeless shelter overflow operations, and we received two responses. One was just a response that they don't qualify to provide that service. Another was that they could provide 16 beds in their facility, and that was it. Our current provider declined to participate in that request for information, and a couple other organizations that we thought might respond did not. So we'll be following up with them to see if we actually have any vendors in the market that can provide that service. So that's more to come on that. Probably you'll hear more about that in the homelessness committee, I'm assuming, in the future. So just be aware that at this point we don't have anyone queued up for May. Lots of activities happening in administration, just moving forward with being prepared to respond to all of the different grant requests that will come out. We have a bunch of renewals this year, so our team will be working on getting the funding renewed for those. I will send you guys an update of all of our board meetings, but I'm not going to review those now. The emergency preparedness response section I will not do until we get to our presentation. In child care licensing, we're continuing to do lots of inspections, renewals, license modifications. We had over 130 walk-in clients in January, call-in clients and 75 walk-in clients. They're very busy, over 400 calls in that month. Go ahead, Ms. Davidson.
Can I ask a question about
Yeah.
that? It's my understanding that the state is looking into, that they do childcare licensing and have delegated that to the Muni, but they're now pulling back that delegation, presumably to not do it themselves and save money. What's the status of that, and how does that impact the update you're getting right now?
We, in our conversations recently this week, we understand they're not going to be moving forward with that. There's a primary, I think we will probably have to continue discussions with them about that in the future and decide as a municipality if we want to invest in doing that work ourselves, if they're going to remove those funds. But at this time, they won't be doing that. Primarily, I think there's an incredible amount of resource and energy that's going to be needed to going towards coronavirus, and so disassembling that program, and that's 10% of our workforce would have a significant impact on our current response. So childcare licensing staff.
But what is 10% of our workforce?
The childcare licensing staff.
At the health
at our health department. So it's a significant amount of our folks. So we work closely with the state, and I think we'll continue to evaluate that in future years. But for now, it is our understanding that most likely won't be occurring this year. But once we know something solid, we'll definitely respond to you about that.
Thank you.
But it's our understanding right now we're just going to be moving forward as normal. Which will be important, and we'll talk about that a little bit when we get into the coronavirus response, because that team will be working closely with our providers and going out, making sure that materials are translated, that they understand how to do their emergency plan, that they know how to control infection in their child care license facilities. So for now, it's the best for all of us for it to stay the way it is. The Community Safety and Development Program and Domestic Violence Program, we did finalize the budget for the Alaska Domestic Violence and Sexual Assault Program. So funds are going out now to Awake, STAR, and Victims for Justice, and our program is continuing forward. We obviously took a significant cut from the state last year, which will impact the amount of service that gets provided, but we were able to maintain most of the core components of that program. You can expect to see from us coming in the next few months the substantial amendments for 2018 and 2019 and the 2020 action plan related to the HUD funding. So that will be coming, more to come there. The Senior and Emergency Services, so our ADRC is continuing to have high volumes, and January is typically a high volume month anyway. So I can share all those numbers with you. I won't go through them now, just so that we can stay focused on the next presentation. Anchorage Safety Center Safety Patrol in January had 1,463 calls and had 909 intakes. They also activated the emergency warming station for us for multiple different nights in January, and I suspect February, and there's probably going to be more in March, because it's getting very cold and the shelters are all exceeding their capacity. In addition to the 166 emergency spaces, there's still more needs, so that need is growing. So luckily the Securitas has basically an amendment in their contract that allows us to ask them to open up if they have extra space that is not being consumed by people who are there for health reasons.
Thanks, Ms. Pineda. So my understanding with shelter was that there are actually sufficient beds for a lot of different types of the population, but there are specific sort of sects of the population where we don't have sufficient beds. I think trans women and maybe another category that's the hardest to find shelter for. How does that play into this concept of there not being enough beds? Is it more generally?
I would say that was information that was more valid in November, possibly December, but as we kept going on in January and in February, we're seeing increased numbers, and therefore the beds for single adult homeless individuals, we are exceeding our capacity.
And so even with the 150 that we added through the emergency funding?
And the additional 16 that, so Beans' contract is 150 on a regular time, but if there's an extra need, they'll go to 166. They're actually having to be in that space way more frequently than we had anticipated. And now we're actually having to use the warming station, which we did not anticipate having to use. So there's just more need.
Do you have any idea how much need there is?
Nicole probably does.
I would say we're not overflowing into I'm calling that the overflow into the overflow. We're not going beyond like 15 on any given night, but it fluxes for various reasons.
And so the warming area is not a real shelter, but a place where people can stay warm, and that's how you count what the need is, because people are there
Yeah.
instead of.
So you have if you have 166 at Bean, so they've maxed out their normal emergency, added the extra emergency beds, and then we're needing about another 15, and then everyone else is full at the same time.
And is there somewhere else that could provide that service, and there's just no funding, or do we not have a place
I
that can
mean,
provide
based
that
on
service?
the responses we got from the request for information, there is no one else to provide that service anymore, and possibly into the future.
I would also add that other places are moving to full to capacity that are specifically within walking distance of the campus. So, and it is just something that has happened. I mean, the weather has changed dramatically, so we're seeing the impact of the weather on this population at this moment in time.
Okay, thank you.
Let's see. Community health nursing has been very busy. They've been working towards really moving towards that community nursing, more focused on community nursing. And so that's been a big transition that they're working through. They've had, recent bloodborne pathogen training we've been coordinating and partnering with the fire department. But I would anticipate that going into the future and even the last 5 weeks, some of our nurses that work in disease investigation and the TB program have been pretty actively engaged around coronavirus, and we think going into the future we're going to really be maxing out our resources in that area. So anticipate that in a future report. Environmental Health Services is plugging around, very, very busy. Their numbers are continuing to go up. One thing we had anticipated in providing today was our annual report, which is just basically kind of our numbers, but we just have been really consumed with things at hand. But we can tell you initially that we've exceeded all of our numbers. So we had more flu shots, more restaurant visits, more of everything. They really worked hard last year as a department. So we anticipate that they'll continue or maintain that level of effort. And we will get that to you when we are able to put our minds on it. But we do have the data collected. But Barry's been pretty busy. And the WIC program continues to move forward. They're continuing to do lots of outreach, and we have the SNAP Ed program. They're coordinating with McKinnell House, Clare House, and other places to really reach out to vulnerable populations to help them access, and Covenant House, to really help them access resources related to nutrition. So that is my main update, and then we can move into coronavirus. I wanted to say that we have Barry, our PIO, and Dr. Chandler, who is our medical officer, and Bill Case, who's the incident commander for our department's operations center, was planning on being here. But as we present you this information, by the time that we're done presenting it, everything could have changed. So the situation rapidly changes from day to day. We're planning on just going through some basic information about what we are doing, some things that are good for you to know. I think Dr. Chandler has some thoughts he wants to share with all of you. And then we will anticipate that you'll have more questions and more information, and broader municipal response outside of the department isn't something we're going to address specifically. But I will talk about, we activated our Department Operations Center this morning to a level 2. We'll talk a little bit about what that means. So we've been at a level 1. Barry's going to walk us through that, but we did kick that off this morning. So right now we have, I think, 12 or 13 health department staff working in our Department Operations Center, doing some preparation planning for executing some missions that are going to become critical. So Bill is sorry he couldn't be here, but I will happily pitch it for him and hopefully do well. I am going to hand this out to you guys as a situation, kind of a situation report and a little bit of a overview of what we have been doing at a higher level. We didn't bring slides because it literally will all change between now and the time we're done. So we appreciate your patience. And do you guys want? I don't know if I have enough for everyone, but Maybe the legal department can share. Okay.
Yeah, we can.
Eugene, did you get one?
All right. Barry, you ready?
Yeah. So today we wanted to give you a little bit of an overview of COVID-19, what to know, and what the health department's been doing and will be doing going forward. Talked about who's presenting: myself, the Public Information Officer, Natasha, and Dr. Bruce Chandler, who's our Chief Medical Officer. So just a little background. I know it's been dominating headlines. Probably everybody knows this already, but started off as the 2019 novel coronavirus and is now known shorthand as COVID-19, as recognized by the World Health Organization a few weeks ago. Originated in Wuhan, China, but has now spread to many parts of the world, including community spread in the northwest of the United States, Seattle specifically. Some coronaviruses, like if you go to the pediatrician, you might have a child that's diagnosed with a coronavirus, because some of them they circulate regularly and they just cause the common cold. But others, like SARS and MERS and COVID-19, can cause serious infections like pneumonia and can really compromise some of our more vulnerable populations. Currently no vaccine available, and that's likely more than 1 year out. Wanted to show you guys, kind of based on, again, rapidly changing information, but you might hear about R0, which is kind of the rate that an infected person can spread. So this is kind of a visual example of measles is amazing at its ability to spread rapidly amongst. So the center dot there is one person, and you can see COVID-19 represented there over there in the middle left. But that could change, and part of this is, as it's been in China, we were reliant on the information from the Chinese government, but as we have more cases worldwide and nationally, we'll probably be seeing some of this information change and become more reliable. One resource that is good to bookmark is Johns Hopkins University has a global cases map, which is linked from our Muni COVID-19 website. And this is a nice way to get a big picture of where it is. It's a cool GIS feature that you can drill down on each location and see how many cases, how many recovered cases, and how many fatalities. COVID-19.
Can I just add one thing? So the Johns Hopkins data is kind of real-time information, and it's good, but you will sometimes see the information from the state or from us come out and be a little different. And that's because we're going to rely on CDC numbers that have been, gone through that process. So I think right now this one has 9 deaths, and the CDC is reporting 6 as of this morning. They update their website every morning at 8 o'clock now, CDC does. So there'll be times when that data is out of joint, but in general, it's a great resource for those who may not be going to the CDC website.
Correct. And Johns Hopkins has the ability to focus solely on their global cases map, whereas the CDC is obviously stretched pretty far for many reasons in response. COVID-19 symptoms that present in as few as 2 days or as long as 14 days after exposure. So you're going to be looking for a fever of greater than 100.4, a persistent cough, and sometimes shortness of breath. But more than anything, call ahead to your medical provider, to the emergency room, or whoever you're going to go see to discuss your symptoms, discuss your recent travel, and discuss potential contact with folks that might have traveled to a affected region.
Can I ask a question?
Yeah.
What about folks who don't have access to health care?
It's a good question.
A very good question.
I mean,
Do
it's
you wanna
obviously a
speak to
bigger
it?
problem than this problem.
And who pays it when they seek their medical care? I don't know the answer.
Yeah, I saw some articles yesterday that Medicaid and Medicare are going to be moving to covering the cost for this, and then I'm assuming there'll be more action. So as we get to the place where we have access to more testing and there's going to be more widespread movement to making sure more people are tested. I think those answers will come, and we'll be coordinating closely with the state on how that's going to get executed.
And to me, it seems like these kinds of challenges are just another reason why we need people to be covered. Because if we can't react quickly, we might lose our opportunity.
They can definitely still call.
Yeah.
Like if you're concerned about it, you can still call. And as they walk through the different questions, it helps eliminate fear of this being the cause of your shortness of breath or your fever.
But to call, you have to have a medical provider, right? So if you don't,
Well,
anyway, I think we're all on the same page. I don't
Yeah,
belabor the
yeah.
point, but
There are some barriers to, whether it's access to information, whether it's access to healthcare. These are challenges that we hope to address. The one positive is our emergency preparedness team has been having telecalls with all of our local medical facilities and hospitals to coordinate, and so they're expecting calls, and they are also preparing for calls to help counsel people through symptoms. And
Very soon there'll be access to resources that are wider, broader than everyone can access.
can
like they're
someone
doing
call
in-
the health department if they have questions? Is there like a line that?
Well,
We don't have a line set up other than our regular health department clinic.
So whoever
line.
answers would help people find the right resources.
Yeah.
Should we speak to 211 at all in the
No,
future?
not right now.
Thank you, Ms. Davidson.
If you have no insurance and you're sick, are you going to be anxious to go into a healthcare facility and possibly incur huge costs to you and your family?
Yep.
I'm sure the free market will take care of it.
It's definitely going to have to be
Always does.
addressed. It's a question on the board right now in our planning.
Thank you.
You guys have probably all been drilled down on prevention so far, but can't reiterate it enough. Whether it's for the flu, the common cold, or COVID-19, these preventative measures really help to reduce spread. We say wash hands often with soap and water. We're going to really start focusing more on what that means too. 20 seconds or longer of good scrubbing, kind of getting people in the mind of taking hand washing, not just frequency, but duration seriously. Avoid touching your face, eyes, nose, and mouth. Again, just simple things that can help prevent the spread. Stay home when you're sick and avoid contact with others and avoid contact with people who are sick. Just basic kind of common sense about how infectious diseases spread. If we can practice some social distancing and be good neighbors to each other, we can help reduce the spread. And lastly, we've all, as the mayor said on his KTVA interview, cover your mouth. Your mom told you, cover your mouth and nose when you sneeze with a tissue or your sleeve, and then wash your hands off afterwards. So just being vigilant about these public health hygiene things will greatly reduce potential spread. And if you do exhibit symptoms, again, we talked about this a little bit, but call your employer. We are working with. We've got a fact sheet for businesses, and we've distributed to a few sources to push out. We're going to push that out more to encourage businesses to let people stay home when they're sick and avoid contact, because it's pretty serious. If somebody's exhibiting symptoms, they need to have the option to stay home. And again, call ahead. We don't want to burden ERs or providers with people that maybe don't need to be there yet based on symptoms, if they can be screened over the phone. And then, as important as always, is listen to the recommendations of your provider at that point. If they tell you to stay home and stay in place, it might be hard for some folks because they might have needs for child care or whatever, but we need to start telling people that they're going to need to figure out ways to stay home if they're exhibiting symptoms.
Can I ask, you might be getting to this, but what is this, is it correct to call it an infection?
It's a virus.
A virus. Is
Dr.
this
Chandler.
virus something that impacts people with lung issues? I mean, I know you said shortness of breath and cough. Is it something where people who have more of that weakness are susceptible? Or is it just general weaknesses of being, old or having other illnesses?
I think they're finding it affects everyone, but but the people with those underlying conditions are at great, though some of them are at great risk of very serious disease and death from it.
Kind of what we're encouraging people, you don't need to wear a surgical mask or other type of mask in public, and we're, the CDC, WHO, the state, we're all encouraging people not to make a run on surgical masks that they sell at stores because, or online, because there's many reasons. One is it could cause a shortage for healthcare providers at some point in the future. The other reason is basically, as we discussed with washing your hands, that not everybody who washes their hands washes them correctly. Not everybody that would use a mask would use it correctly. They might wear it too long. They might set it down and have the mask get infected. So we're discouraging the general public from wearing those masks in public. No need at this point to avoid public transportation in Anchorage. No need to avoid public gatherings at this time in Anchorage. And we really are trying to reiterate that we don't want anyone to be discriminated against or stigmatized based on their race, ethnicity, or recent travel.
And if this changes, we'll let, the public will be informed of any time any of this stuff changes as we learn more or cases arrive in Alaska.
Current risk level in Alaska, no confirmed cases, and the immediate health risk is still considered low.
Next question, Madam Chair.
Mr. Dunbar?
Approximately how many people in Alaska have been tested?
I don't know the answer. Do you know the answer?
That's the question.
How many people have been tested?
As of yesterday, I'm aware of 3.
Yeah.
So we don't know that there are any cases, but we've only tested 3 people.
And I can tell you from conversations with other healthcare providers that many think that it's likely the virus may be here, but because of the limitations on testing, we're just sitting here fat, dumb, and happy, and maybe we shouldn't be. So, but
Very reassuring.
We're not here to reassure you. We are here to let you know what we're doing and to be prepared and recognize that it's very infectious.
But beyond the 3 tested, there's also been folks that were monitored based on their travel. You might have seen the story about a Mirror Lake middle school student whose family had traveled back. So while there hasn't been testing for everyone, there have been people that were identified to be monitored by our public health nursing staff. So it's not just that it's only been 3 that have been looked at. There's been others that have been cleared after a 14-day period.
at the moment we're strictly adhering to the CDC guidance on who to test, because I think they had 50 tests originally, and they're hoping to get another 50 tests available in the next day or two, but they don't have the capability for mass testing yet.
And that's just because it's a new virus and figuring out how to test it and to produce it and all of those
And
things.
to make all the reagents and distribute the
Yeah.
reagents, it's a big problem.
Did you have anything else, Mr. Dunlap?
No, it's fine, thank you. Sure.
Stress current CDC travel advisories, because they can change at any moment. We've seen it happen, but currently avoid travel to China, South Korea, Italy, and Iran, and consider postponing non-essential travel to Japan. And they've got listed right now destinations at risk of community spread include Hong Kong, Singapore, Taiwan, and Thailand. But again, these are things that could rapidly change, and we're going to encourage the public to always check cdc.com or .org or .gov travel, which has great resources there about how you can educate yourself about where you're headed and risk.
So I have a question. Probably most folks have heard that the school district first canceled international travel, and then a couple days, canceled all travel, which really bummed out my 2 kids who were supposed to go to California for band trips, but that's for March and April. On the business side, and maybe this will come up later, do you have specific directions for businesses that have like 100 people or so working on site, beyond the travel advisories? I know for some organizations, business continuity plans include closely working with local agencies on following protocols for disinfecting buildings and clearing buildings and so on. That may be more in the about to come category.
Well, as we get them, we're posting them on our website or distributing them to agency groups that can spread that word to the broader population. So I know there was just some new guidance on, I wish if Bill was here, he'd be able to speak to it better. There was some new guidance on a certain protocols for cleaning, and that's going to get distributed and posted. I think there was some new guidance from the CDC, just got updated, childcare licensing guidance, so they sent out some original, then they made some modifications, then we take that and we make adjustments or review it based on our population, and then we distribute it to that group. We've had some large business entities reach out to see if we can do plan review. Are they on the right track? We're a pretty small shop and have a limited capacity, but right now that we've activated, there'll be more resources for doing that function. As we get to talking a little bit about it, we're definitely making a strong and concerted effort with shelter providers and permanent supported housing providers who have particularly vulnerable populations, and making sure that they have access to the infectious control plan. Are they using it? Do they know how to use it? Have they applied it to their workspace? Because there is we can provide guidance, so we can provide what we're getting from the CDC, and we can look and partner, but we can't dictate what businesses do or how they manage their business and their risk, but we can advise them. And we've been doing that in many cases.
In our, to follow up on that, the PDF on what businesses can do that we distributed and have available on the website for a couple weeks now. It's all a blur, but I believe it's been a couple weeks. Covers, there's a section that covers employees that are abroad, potentially in communities and areas of risk of community spread, and what they can do, and the risks of leaving their folks there versus bringing them back. So that's covered, and that was CDC language that we took and repurposed for Alaska.
It's been communicated to me that there's some infrastructure organizations up here, obviously with oil companies and the pipeline and some of the protocols that they've put in place to protect their workforce. So some businesses have a much more sophisticated contingency plans and all hazard plans, and drill it all the time, because those are significant to infrastructure. It's smaller businesses and other entities that maybe didn't have the resources to do that kind of work is where we're going to start, kind of like we would do in an earthquake, right? You're going to do your vulnerable populations. The state will be doing a lot of guidance and work around assisted living homes, because they license those organizations, so they're providing lots of business advice. I think they'll be doing that with other provider groups as well. So everyone, whether it's the state or local, will be partnering to make sure that everyone has access to the information so that they can make those decisions as businesses.
Thanks. I know we have two members of the public who came over from ConocoPhillips, and we'll have a section for public participation, but if there are people here who have specific questions, definitely we want to get those answered. Okay, thanks so much. Oh, Mr. Rivera?
Yeah, thank you, Madam Chair. Since we're talking about at-risk populations, I have had some questions come in from my constituents about homelessness, so thank you for working directly with the shelters, and please keep us up to date on that. That's a particular concern. Two other at-risk populations, though, that I didn't hear you mention. So specifically, low-income families and individuals who can't afford to take days off from work. And then second, non-English speaking families and individuals. Could you address those two?
I can address the non-English speaking. Our Muni.org COVID-19 site has Google Translate, and I've made sure that it's translatable into all the different Google languages. We're also checking with an accessibility expert to make sure that that is solid beyond just what Google's doing. And then we started with kind of those basic prevention tools and what you should do if you are exhibiting symptoms. We worked with the Language Interpreter Center to translate into we started with 6 low English proficiency languages. I think the one challenge that we've started to meet, but will meet further, is amplifying this message. So that's one of the goals, is to get those resources out And one change going forward that I'm working on is to even simplify that information further so that it doesn't require constant changes, so that it, once we have a copy, it can live in somebody's hand and not need to be updated. And that it's also easy to understand. So we're getting away from paragraphs and getting more to pictograms and simple language. So in terms of access, that's one of the ways we're working.
And then if there's any future press conferences or informational stuff, that'll probably most likely be handled just like it was in the earthquake. There'll be ASL, accessibility, and all of those things. We work really hard at the municipality to make sure that all of our residents have the opportunity to read and understand what's going on. And as we've activated our DSC, that gives us more people that are working specifically on this mission to help distribute and communicate some of those things or finalize them and get them out. So we should be able to move a lot more rapidly over the next week and a half, I think, on that front. As it relates to low-income families, I'll put it on the list. I don't know where we are with that and what the strategies will be, but that's something that the Department Operations Center can work through to identify what are the needs of that population. Obviously, we don't have any authority over their business owners or their employers, and that's kind of gets back to that issue around, access to insurance, access to leave. Not everybody has that, so it's a good point. Thank you.
Thank you, Ms. Pineda. Thank you, Mr. Rivera. We've been joined by Mr. Weddleton, and we've got Ms. Davidson and Mr. Dunbar in the queue for questions.
Thank you, Madam Chair. I just wanted to point out that the mayor and his team, because of the work the city has done, was selected nationally to do a resiliency summit in DC, and I got to go because he was busy, lucky me. And part of the work that came out of that was doing emergency preparedness information, as you all know, but for the public, in different languages, and that makes us as a city more resilient. So just sort of want to fold back into the work we're doing. Keeps us stronger. And then I wanted to ask this is sort of a more general question, but how do you coordinate with the state and the federal government? Are there set roles of what, maybe you're going to talk about what you're all doing, or
there is a slide where we're going to get to that, but I don't know what Bill was actually going to say, so I'm going to do my best to hit that and describe what that is.
If it fits better.
I think it's like 2 slides from there or something.
More questions?
But the first thing we did, just to be honest, was like the third day. I think by the third day we had translated all those documents into at least the 7 languages. We have a language access plan at the health department, so that's just front and center for us when we're in a situation like this, sort of along the lines of what we did with the measles. So right around Christmas time, we actually wanted to make sure to get out to a particular population very specific information about measles, because we knew there'd be large groups from Anchorage going home or visiting family. So we got that translated right away and pushed it out to that community through basically community leaders and thought leaders from that group. So we always try to do it. We don't always get it perfect, but we refine it as we go along, and Barry's been doing a great job on that.
Is measles one of the viruses? Is it a virus? Viruses that people decline to get vaccinations for?
There are people who decline everything.
I mean, it's sort of crazy, right? You see what people think about the coronavirus, and it's like 3 times more infectious. So.
And sometimes the people who are declining all the routine vaccinations all of a sudden want the new vaccine.
So interesting. People are interesting. Thank you.
So one other aspect of the translated materials is we've removed our logo from those and shared them with Juneau asked for them. I believe Fairbanks asked for them. So I don't know if they're going to actually take our resources and slap their logo on it or not, but we're also, we're sharing, and that's part of, for about a month, I've been on a joint information call with many partners across the state. So we're sharing resources and information and strategies for a while now. And speaking of that, reliable sources and information, the CDC, WHO, and the state of Alaska are all great resources. And then, like to plug our own website as a place where If you go to the CDC website, it has everything. It has all the information you could imagine and more, and it can be a little overwhelming. So what I've tried to do with our standalone webpage is simplify it, make it more accessible to the average person, and not overwhelm people with too many, a wall of links or a wall of text. Make it a little more visual and accessible. So I'd encourage you guys to push people towards these sources, share information from these sources, and just really question where your information is coming from when you're reading it, and to encourage constituents to do the same. This is where Bill Kays was going to come in and talk.
Sure. So I kind of already mentioned this. We started at a level 1 on January 25th, and that means we've been all, primarily our EP team, myself and Barry, have been really focused on this. We've sent out special projects to different parts of our department, but we have immediately been working with the state. So the state set up a joint information call that's broadly addressing this issue, and we've all been in this kind of surveillance level. We've moved now to this level 2, which means we're actually putting more staff. We've exceeded the capability of the emergency preparedness team and the director and the PAO, and so we're actually asking staff to work on this. And the next level would be a level 3, but we're in this partial activation for now, and we'll continue to be in that. If that changes, we will notify you. As I said, our staff are working between the hours of 8 and 3 p.m. exclusively on this. We have I think I already described this, but we do have a subsection related to homelessness and permanent supported housing, and that is actually staffed by a staff member from the Anchorage Coalition to End Homelessness. And so they're going to be coordinating closely with us in that particular work area, which is really nice. They happen to be co-located in our building, and so it was just a natural fit, and they made their staff available for that. I'm sure Bill would have had a lot of other wonderful things to say about this. And
I'm going to go back a couple of slides. We jumped ahead to response level 2. I can speak to this one if you.
I'm happy to.
Okay.
So, to talk about, do you guys have more questions about the repatriation flight? We did talk about it pretty extensively at the assembly meeting. Okay.
Actually, I have a quick question as to quarantines. Is that something that your department can require of people, or do you have, is that?
So how it works is we've basically made a resource request to the Office of Emergency Management to have and then they make a resource request, I think, to legal, and then legal answers those questions and looks at it. So then I think the administration can speak to that. Part of our role is to say, we'll do resource requests either to our Office of Emergency Management or to the state, depending on what the need is. So if we exceed our ability to, say, respond on the ground to setting up a set of services, and we would put in a resource request to the state and say we have exceeded our capacity, exhausted all of our ability, and we need this resource from you. And then the same thing will happen, much like happened in the earthquake, is this resource request that says we're doing this health function, and there are other departments would do the same thing. We're doing this function, and we're going to send that request, it's a municipal request, through the Office of Emergency Management. So I think the administration will be looking at that question for us. But I don't believe right now we have the ability to do that.
The one note I wanted to, part of the reason why I included this slide, even though it's been a month out from the repatriation flight, was it kind of came back into the news because there was a whistleblower that said on the ground at March Air Force Base that there wasn't proper PPE worn by some of the staff that greeted the 195 passengers there. 2 notes. First is that all the passengers passed quarantine and were released successfully, so that was a successful part of the operation. The other thing, though, is we had our crisis health action team members help screen at the North Terminal, and I just wanted to add that we are aware that all of our staff and all the CDC staff wore proper personal protective equipment there to kind of put the public at ease that despite that whistleblower report about California and whether the veracity of it is true or not, that we can attest that we were wearing proper PPE and all of our folks have passed through that 14-day period also after the repatriation flight with no symptoms.
So we have lots of partners. We are partnering on a regular basis with Health and Social Services, CDC, the school district, the Joint Medical Emergency Preparedness Group, lots of social services organizations and departments. we have a regular call with the healthcare providers, and we're on calls throughout the day. In fact, that's where Bill is right now. He's on a call with the state. So there's a lot of coordination occurring. There's obviously a lot happening, and things move really quickly. So just being vigilant and continuing that communication, and as we form incident command structures that allow that information to come in more quickly and in an organized way, I think that we'll be in better positions here in the next week or so from our department standpoint.
We have a question for Mr. Rivera.
Thank you, Madam Chair. So, yeah, on this subject, I very much appreciate the level of response and preparedness from the health department. But we have tens of thousands of people who come in from outside of the municipality every day to Anchorage. So I think you answered it, but so is the state and other parts of the state at the same level of preparedness as we are?
I mean, most of them don't have necessarily, they don't have a health department, but I know the state's having regular calls with them. I can't speak to what the state's doing, so I think if there's a need or an interest for a report out from the state, we should invite them to some format where that would be appropriate for them to brief you on their activities. I know they are all working round the clock, very busy. They have their emergency operations center activated as well as the health department. They're producing lots of materials. You've probably seen Doctors Inc. out presenting in the community, on doing press conferences, providing information. They're working around the clock on this. And I know that they have some specific mission focus areas around the airport and other areas, so really they're best suited to speak to some of the things that are within their control.
Additionally, I can say that I know that Bill and the emergency preparedness team have had, we didn't list them as a partner here, but they've shared resources with City of Wasilla and their emergency preparedness group.
And Matsu Hospital is on our joint call, so there's coordination there as well, which is natural. Let's skip that. So, I think Bill probably had a lot to say here. We're one of the only, I believe, local health departments that have health powers, so we have a health department. It is small. We have, I think, 13 public health nurses, half of which during this situation will still be responsible for, we're going to have to continue to monitor tuberculosis, STIs, provide services that are critical and necessary to continue to prevent disease spread of other things. And so there will come a point where we will need resources from the state to help us in our response. The way it works now is, like, for example, there's been a lot of questions about testing. So one of the things, like this is a good example, and I can have Bill put together some talking points that explain more what the role of the state is and what the role of the health department is in a public health emergency. But for example, the state lab are the there's two state labs of Fairbanks and Anchorage, and they're the places that actually process the samples, and Dr. Chandler could speak to that. There's lots of people that maybe will be able to administer testing. That'll include public health department staff. That'll include primary care providers and doctors as this expands. But the testing itself, like the function of the lab is a state function. We do not have any authority or control over that, but we work really closely with them. So I think Dr. Chandler had some wrap-up comments I know he wanted to make, and I know we're getting close to time. But I can have Bill send more information about the function, but we're a small, we have a small workforce, but we also have lots of municipal assets that will be deployed to help respond as this moves forward, and I'm sure the administration can speak about that. But for now, we're going to work really closely with the state, ask for help when we need it, and continue to move forward.
And before we continue, could I get a sense of how many people in the audience wanted to participate? 2? Okay. We are down to our last.
Yeah, we might not
So I want to
be
can we
minutes.
make sure Dr. Chandler just has this moment, and I had a couple things he wanted to share. I don't know what they are.
I want to share why I don't sleep well at night.
Gonna make us not sleep well at night.
I hope to. So,
We have to deal with this every day.
That's a great doctor.
I'd like to
Give him
share a
motion.
few of my concerns. Number one, much of the messaging from the White House seems to be more concerned with public relations than it is on protecting the American people. And it really bothers me. Some of you must know Jay Butler, who's worked in infectious disease here for a very long time, who's now Deputy Director of Infectious Disease at CDC. He's part of the team that's working on this. And then we've seen Dr. Fauci at NIH, and well, now all their messaging has to be approved by the Vice President, and the Vice President directs who they can talk to and who they can't. So I don't think we can be reassured we're getting the full picture. As we're seeing in Seattle, coronavirus is not a political hoax. All right, it's a very serious problem, and especially in the long-term care facility with many people dying. They're elderly and have high-risk conditions, but what if that happens here, the Pioneer Home or one of the extended care facilities? How are we going to deal with that? It's a nightmare, and we're getting emails from Seattle that just describing how much they're dealing with. It's interesting that we're continuing business as usual, and conferences are being continued around the country. And so, what is the Emerald City Comic-Con next week? 100,000 people are traveling to Seattle for that event. And how many people are traveling out of Alaska for spring break this weekend? I think we can well expect, if the virus isn't already here, it will be after spring break is over. And, it's been, we've witnessed what happens with coronavirus on a cruise ship. Can you imagine one of the cruise ships moored here at the port of Anchorage with coronavirus circulating, and how we're going to deal with that, or in Juneau, or Whittier or Seward? Tremendous problems for us. But I still see tourism companies marketing. You can't cruise in Asia, but why not divert to Anchorage? So I think there are reasons for concern. I've been impressed. The health department, great effort. Local hospitals, local healthcare providers. I work at the neighborhood in the afternoon. There's a lot of attention to how to safely, for training staff to safely evaluate and test people without becoming infected. That pleases me. We had an email this morning from the infectious disease specialist at Evergreen Health Center in Kirkland. With their first 2 cases, they identified 350 contacts to those 2 people. And they are overwhelmed. They don't have, both at Evergreen and Seattle King County, don't have the people to adequately track every single person to make sure they're not developing symptoms. So I think we would be if we had more than a few cases, we would likely be in a similar situation. How much trust should we put into the federal screening program at airports? I'll just tell you one story. A family came back early last week from China. They visited in China. They went through their screening at LAX and then flew home. And they're well, but the parents had notified the school they were coming home and wanted to find out what they should do with their kids before letting them return to school. And it all got worked out. The kids stayed home for 2 weeks, and then they go back. They're doing well. But the quarantine people were, in a perfect world, the state should be notified that these people are progressing on to Anchorage, and then they go into our monitoring programs to keep daily touch. The state never received any notification of these people, so I'm not sure we can put great reliance on that. I think from the experience at Evergreen in Seattle, Evergreen in Kirkland and Seattle, it's public health and the hospital systems, healthcare systems don't have adequate staff and resources to fully address this. I think there's a tremendous need to engage the community and get people aware of what might happen and how we're going to get through this together. There's a lot of misinformation, and I think if we can target more people through social media, it may have benefit for us in the future.
Thank you for that update. One quick question, and then we'll go to Ms. Quinn Davidson. There seems to be an expectation that the coronavirus will just die out come spring, like as we see.
According to the president, that's what's
Okay.
happening.
So that would be a no. That's not a reasonable expectation.
He said something factually incorrect.
We have to make our own. So wouldn't that be wonderful? And I think like with influenza, as we move into the summer, people are not concentrated in schools and more people outdoors. Some viruses become less transmissible. The other thing, flu season in the southern hemisphere is just ramping up, and every summer we see influenza coming along with those tourists from the southern hemisphere, bringing that to Anchorage. I don't have great. I guess in 2 or 3 months we'll know, but I worry in the meantime.
Thank you, Dr. Chandler. Thank you, Mr. Kaiser and Ms. Pineda. Ms. Quinn Davidson?
Yeah, I was just wondering if the mayor wouldn't mind just quickly talking about the other things the city is doing, whether it's procurement rules or preparing for emergencies or anything sort of beyond the health impacts.
There are a number of steps that we're taking so we can be prepared for a contingency that we hope never arrives. We're modifying our protocols for remote site working, continuity of operations. I think that's an important thing for us to do. APD and AFD who are here and can speak to it are just in a heightened state of vigilance, but are really not doing anything significantly different than they have been doing in the past. We are looking at what we can do to enhance our ability to test and contain not just this infectious disease, but any other infectious disease that could come our way from a legal perspective, but also in terms of the infrastructure that's available to us. I mean, the health department does a spectacular job with far fewer people than it once had, and it does it with meshing together with a state partner that is much smaller than it needs to be. So we're looking at ways that we can ramp up our capacity there. We're looking for best practices around the country and around the world that we can implement. So we're, just like the health department has gone to sort of level 1.5.
We're at 2.
Level
Officially,
2.
8 a.m. We're at 2.
We're at level 2 along with the health department. But, I mean, I want to emphasize that this is one of these things that we can take precautions. Wash your hands, make sure that you're prepared, stay calm, and I think we will do this the way that Alaskans have always encountered any kind of difficulties. Just keep an eye on how you're feeling, keep an eye on how your neighbors are feeling, and we will be all right.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor. Thank you, Ms. Quinn Davidson. Mr. Dunbar?
Yeah, I just wanted to say briefly about the Assembly Department's role in this in response to this. We had a leadership meeting yesterday, and Ms. Jones, the clerk, was thinking about these issues with regard to her staff and changing policies with regard to remote work if people aren't feeling well. There is a specific legal concern with the Assembly, and we have a charter duty to meet twice a month. So we've talked to legal about what exactly that means. We need 6 people present in person to form a quorum. But of course, the charter was written before we had technologies like video conferencing. And so we're working with legal now to sort of figure out, could we, if we had a number of people that felt ill, could we use something like video conferencing to meet our charter obligation? But it's something that the Assembly Department is also thinking about, and sort of mirroring what the mayor said, thinking about things like remote work and trying to put our employees first.
Thank you, Mr. Dunbar. We're running over a little bit, but we do have 2 members of the public who wish to participate. So let's go ahead and go to audience participation. If you can be
Real brief.
a minute.
Ron Oliva, Jason property owner to the shelter and beans. As far as the overflow, I signed a letter of intent to sell. I'd like you to accelerate that program because I was designated a chemical terrorist when I was given permission to put down a disinfectant not a hazardous waste in the shelter area due to the sanitary conditions there that are deplorable and still are. One of the requirements is to use hand sanitizer. You can't do that at the shelter or Beans because they drink it. So you got a real challenge down there. But I'm the adjacent property owner. If this coronavirus or any outbreak, MRSA, etc., the isolation will be there. I'm going to vacate early, and I'll vacate right now if you need that overflow facility. And at the last homeless meeting, you questioned the management of CSP, the picking up the Anchorage Service Patrol. Were their employees flipping jobs, turnover? And the answer was no. The biggest challenge was absenteeism of the driver and the medic due to sickness. I want to make sure that's monitored and not spread, because you've sent another 166 people with an extra 15 standing up in tight conditions with 60 to 80 campsites next to me, and I'm in between that. You make 12 to 1,500 meals a day at Kids Lunchbox and over 1,000 at Beans, and you're on the bus route. I brought this to your attention years ago, and nothing was done. Now we're facing a crisis, and what's going to be done? We're going to follow the plan of the mayor. He handled the earthquake really well. He can handle this well if we stick together.
I need you to wrap up, Mr. Lee.
No problem. Do you have any questions?
Thank you for your testimony.
Okay,
Mr.
take
Haberman?
action. Buy my property would be a good move.
Thank you, Mr. Oliva. Mr. Haberman, if you could be succinct, please.
My name is Eugene Carl Hamer. I live in the Manistee Valley. Follow the public process. When the public process is done appropriately, decision made by the governing body is more like public interest. We've been experiencing the flu. Thousands of Americans have passed away. How we handle that situation regarding the flu? We go to public meetings sick. Elected officials here in this room come to this room sick. We've allowed also a scenario of that's the way it's going to be. And there's concern right now about the actions by the district to deal with restricting travel and the concern of the costs, the financial cost. Well, we should remove ourselves from the issue of financial cost and deal with the health cost priority and how it's going to affect the financial cost if we don't deal with it appropriately. Now, number one, when we were moving into what we call quarantine in America and outside, the scenario is we allowed students to come back from China, and the reports were that they went to schools like middle school without a quarantine. That's how we handled that a few weeks ago. We also, about a week ago, 8 days ago, at the last assembly meeting, in my comments and ordinance participation, I raised concern on this issue. And response in closing comments by Assembly Member Constant is, we're over concerned about this issue. The response for the words of Assembly Member Constant was silenced by the Assembly. I appreciate very much you having this conversation, but you've shown unwillingness to deal with how you behaved on the flu in
Mr.
America.
Haberman, I'm sorry to interrupt. Would you please wrap up? We are over time.
We're running out of time on this issue too. But in closing is the fact is, I heard these words by Assembly Member Dunbar, who I've witnessed being sick at times in these meetings in this very room, that we need to put our employees first. That's not right. We need to recognize we're all part of the team in this situation, the public, you all. And we cannot have priorities for one group and another group. And the end result is, in closing, the presentation today would have been great if the people heard this, but few in this room heard it. And when I asked for the copy of this presentation to be able, before this meeting, I was told by the presenter that in closing, that they were updating it as we
Mr.
speak,
Haberman, move on,
and the
please.
public doesn't even get that.
I got it. Thank you, Ms. Quinn Davidson. Thank you to the Health Department for this presentation, and would you make this available to us as you typically do? Okay, and thank you all for coming. You're adjourned.